Dr. Azizzadeh, we were mentioning well, the two-dimensional with regards to facelifts. When in the 80s and 90s, when they had the facelifts, it was pulled too tight. As was mentioned, when it got pulled too tight, I guess the results were done, but they were two-dimensional. They looked fake. They didn't have it. The face didn't have any emotions.
A lot of people say the face doesn't have any emotions, and unfortunately, the facelifts of the past were like that because they created a two-dimensional facelift, flat affect, and patients didn't have that third dimension because all people did was pull the face tight. So today our concepts are very different. We know certain areas of the face, such as the cheeks, such as this area which we call the pre-jowl or marionette lines, and so forth, have a significant amount of volume loss. Out here where the jowls and the neck and loose skins form, it's not so much volume loss, it's just loose gravitational skin. So the surgery of today and the and that's why I almost never use the word facelift as much as facial rejuvenation, is because you need to address certain areas with lifting procedures, certain areas with volume procedures. So the volume procedures that we use if we're performing surgery is fat grafting, or what I call multi-level fat grafting. If we're not performing surgery, and for patients who don't want to have any downtime, we're using fillers and injectables such as Sculptra, Radius, Restylane, and Juvederm. So we need to take into account both volume loss as well as loose skin when it comes to the aging process. And some patients don't need a facelift, they just need volume restoration. So it's very, very important, and that's why patients look so much more natural today, at least with the physicians who really think conceptually in this manner.
You mentioned fillers quite a few times. What do you think about fillers? Does it make up a large part of your practice in the sense that do you really think it could help people? Because people always think of fillers as this very temporary thing, and that they always want to just jump into the surgery aspect of it because it's much more permanent. But don't fillers offer certain advantages?
Fillers are wonderful, and it depends on what you're looking for. There are certain areas, certain aspects of fillers that really make it a lot more user-friendly than surgery. Patients who don't want to have a lot of downtime, patients who don't want to have surgery or are worried about any surgical anesthesia and so forth, and people who don't have time for surgery, and a lot of patients who are not candidates for surgery. So fillers are wonderful, and today we have a huge number of options. If you want something that lasts 6 to 12 months, there are Restylane and Juvederm. For patients who want something a little bit longer, you can utilize Radius. For patients who want maybe a 2 to 3 year outcome, you can utilize Sculptra. And fat grafting, or multi-level fat grafting, which is kind of what I would call a hybrid, not major surgery, also not a minor filler, can last a long time as a permanent in a sense, filler for volume restoration. So there are a lot of options, and most of these options are really, in a sense, lunchtime procedures with minimal downtime.
Okay. So you can use fillers to fill in your cheeks and give you that nice cheekbone look, or maybe bring out a little bit of a receding chin. Fillers can be used for that sort of
fillers can be used basically for areas that are hollowed out. I mean, if you think about hollows, the face, you want to have highlights on your face, not shadows. And anywhere you see shadows, which could be under the eyes, in the cheek area, deep in the laugh line, and deep in your, what I call the marionette lines, or even a recessed chin, all of those areas can be addressed with fillers really nicely. Now you got to pick and choose the filler. For example, for under the eye, you don't want to use Radius, you want to use the hyaluronic acids.
Why is that? I'm sorry to
Because they're finer, they're more gel-like substances. You have very thin skin under the eyelid, so it works much better, and it's reversible. So if there's any issues, you can reverse the fillers and in a sense get rid of the fillers. So it's really, really a great option for under the eyes, for lips as well. Whereas Radius lasts much, much longer for the laugh lines and the pre-jowl area. And Sculptra is probably the longest lasting filler that's not permanent, and that gives you a really full facial volume restoration, and it works wonderfully by building collagen rather than filling. So you have so many different products and they all work very, very well, and it depends on what you're looking for. But there are a lot of different options.
You mentioned Sculptra. Can Sculptra be used for the chin?
Sculptra can be used anywhere on the face, at least in my experience. We try to limit its use under the eyes because of the same concept. But Sculptra, anywhere that there's hollows and volume loss or structural deficits, Sculptra is a wonderful product because it basically, unlike the other fillers, it structurally builds up the volume, and it builds it up with your own collagen. So as the Sculptra starts going away, your collagen builds up in that area. So it's a really wonderful product, and it's been used for a long time by myself over the past 5 to 6 years in the U.S. and longer than that in Europe.
Okay, I see. Let's talk about as we wrap this up. Let's talk about maybe a surgeon or something that was significant in your career that was instrumental in your success. Was there a teacher? Was there a surgeon? Maybe your Harvard education. I don't know if we mentioned it for our viewers, but you're actually a graduate from Harvard or Harvard University.
Well, I mean, there have been, I think, I've had many. I've been very fortunate because I've had great mentors. Probably 10 people have been instrumental in who I am today. The two most important people, I think, in my career and training, one was at UCLA, Dr. Keith Blackwell, who was an amazing surgeon who I worked with and learned from, and Dr. Mac Cheney, who I trained with at Harvard, who is an amazing physician and surgeon, and they've both been instrumental in who I am today. I've had many other amazing teachers, amazing colleagues and friends who've been instrumental in my career development, but Dr. Blackwell and Cheney have been really probably the two most important ones.
That's great. Well, Dr. Azizzadeh, thank you so much for doing the interview with us.
Thank you so much.
Was there anything you'd like to add or before we finish?
No, I mean, I think the most important thing for your viewers or for your audience is just choose carefully. Make sure you do your homework. And once you've found a surgeon that you've put your trust in, let them guide you. Because a lot of times we try to take a lot of control in what we want to do, but once you have the expert that you believe will be able to help you with whatever issue you're dealing with, let them guide you and be decision makers together.
Actually, before we do wrap up the interview, this is something I'm not familiar with and is not part of our website, but I wanted to get it in. And that's something that you're an expertise in. It's called Bell's palsy. I'm not sure if I'm pronouncing that right. Now, can you explain for our viewers what that is? I personally don't know anything about it.
Okay.
But I do know that you're involved with that. It might be a longer discussion, maybe another time.
Sure.
But can you give a brief description of what that is?
Sure. So one of my passions is treating children and adults with facial paralysis. Bell's palsy being the most common cause of facial paralysis. Basically, the nerve that goes to the face and moves the face, essentially for a variety of reasons, can get injured, and the face has dysfunctional movement. In kids, it can be devastating because, as we know, growing up, if your face is deformed and you don't have appropriate movements, it could be very challenging and devastating. So that's an area that I'm very passionate about. I just recently formed a nonprofit foundation called the Facial Paralysis and Bell's Palsy Foundation. That's going to basically dedicate a lot of time to nerve regeneration research and pro bono work for individuals who come from lower socioeconomic situations, who can't afford to have the appropriate operations. So it is a very, very important part of my career, and I truly enjoy taking care of patients who have facial paralysis.
Well, thank you, Dr. Aziz.